My warmest greetings to all the viewers. You see, I take the privilege of introducing Asha ji and Ritika to the audience today. I mean, I wish to have a meaningful interaction so that people understand at large what is the particular benefits of using a robotic platform, especially in a surgery like gallbladder stones, where laparoscopic cholecystectomy has become the standard of care. And why do we use a robot, and what are the benefits of using a robot? Ritika is a master's in biotechnology, so she knows our subject, medical subjects well. She's doing her PhD in a niche aspect of renal transplant cytogenetics. And Asha ji had come to us with stones in the gallbladder, chronic cholecystitis, and we suggested that it'll be safer to do a robotic cholecystectomy, a robot-assisted laparoscopic cholecystectomy. Present day scenario, the insurances, most of the medical insurances don't reimburse for robotic payment, and so we did discuss that they may have to spend a little money from their pocket, but it'll be safer. So I will leave it to Ritika to let us know what was in their minds when they decided that yes, they would want to have a robotic um, assisted surgery, and then I would share with you what were the benefits when we used it. Batao, Ritika.
Hello, sir. Sir, so we decided to go for Lepro first,
Yes.
but then we came here and you guided us really well. And I also read about robot-assisted surgery. So there is less tissue injuries when we opt robotic surgery. And you guided us actually really well with the diagrams and all, and we were really convinced. And for us, the health was our priority. And yes, my mother is really fine. And after immediately after surgery, she was active, she was walking. And at her age, when she's really weak actually, and severe osteoporosis she's suffering from. But just after surgery she was talking, and then she like
I
started
think the same
walking.
evening she was walking about, and we could have discharged her the same evening.
I
But
think
perhaps
after 4 5 hours post surgery,
she was walking.
she was able to stand, and she took 3 4 steps, and in the late evening she was walking. So
And the
after,
next day we let her go home.
next in early in the morning, we did our discharge and
आशा
other
जी आप
this
बताइए
thing.
कोई तकलीफ हुआ? Absolutely not. Absolutely not. दर्द हुआ ही नहीं होगा. So मैं आपको बताता हूँ कि what were the benefits of robotic assistance. You see, in her case, कई बार तो easy gallbladder मिल जाता है हमको, तो जब सूजन नहीं होती तो उसको आराम से हम निकाल पाते हैं, लेप्रोस्कोप से भी निकाल पाते हैं. 90% of the times, but 10% times I mean, we had not thought of it. That's the kind of scenario inside. जैसे कि इनके अंदर हम जब हमने स्कोप्स डाले, एंडोस्कोप्स डाले, तो it was an extremely bad gallbladder. It was buried inside the liver. The liver was overhanging. It was almost impossible to have taken it out with a laparoscope. So that's when we thank God that you people had agreed for robotic assistance. Otherwise, we would have had to either open her up, or we may have landed in some trouble and caused some injury. So we can never kind of before surgery say that it will be that necessary or not. But after having done her surgery, we realize that it sometimes does save life. So with a little extra money spent, I think one should not compromise on safety.
Life is more
Life
important.
more important. One should not compromise on safety. It definitely makes our jobs easier, more precise, and patient is much safer.
Safety and life is really important.
So I'm very happy that you agreed that okay, we'll pay a little extra amount. Suppose the insurance doesn't reimburse. Suppose it sometimes does.
Yes.
Insurances are also getting wiser that it is required, and so many times they do reimburse, but sometimes you have to struggle, and sometimes they do not budge. So that is, so pre-operatively we can't tell you that insurance will pay or not. So well, but we have had a successful outcome, and I thank God for that.
Thank you so much, sir.
Thank you, my dear. And in passing, let me share with my viewers. Ritika's mother-in-law was operated by us,
Yes.
the
Yeah.
same team, for cancer of the lung.
By
About
lobectomy.
2.5 years back, we had removed half her lung, and she's doing well.
One lobe was removed.
One lobe was removed.
And she's doing well. She's doing well.
Absolutely, God is kind.
That's why we, for my mother, we also wanted you to be her surgeon.
Thank you so much.